My name is Vanessa Maydew. I am Communications and Knowledge Exchange Specialist for SEBI Livestock, the Center for Supporting Evidence-Based Interventions in Livestock. Welcome to this Livestock Data Summer Session. So this month, the Livestock Data for Decisions, LD4D Community of Practice, is hosting a series of learning events to showcase the work of our members. The LD4D Summer Sessions offer unique insights into tools, techniques, and opportunities. These one-hour sessions are aimed at researchers, project implementers, industry, and funders who work in livestock development and are interested in livestock data. So just to mention, before we begin, can I ask participants to rename themselves with full first, last name, and organization in the participants list? That would be really helpful. Today, we welcome Dr. Lamyaa Al-Riyami from GALVMed and Dr. Emilie Veillat, the Veterinary Public Health Center at Boehringer Ingelheim, to share the LastMile mobile app. They will give us an inside look at how an animal health company is digitizing their project management, their project operations, and how they're gathering data, and also how they're working with an organization like GALVMed, which aims to transform smallholder livestock health in low and middle income countries. We have two speakers today. Dr. Lamyaa Al-Riyami is GALVMed's Senior Manager, Evaluation Program Planning, based in Edinburgh, Scotland. GALVMed works to make livestock vaccines, medicines, and diagnostics accessible and affordable to the millions in developing countries for whom livestock is a lifeline. Her role involves coordinating, evaluating, and reporting GALVMed's activities. She holds a PhD in immunology from the University of Strathclyde and was previously a research fellow at the University of Glasgow and also at Strathclyde. Our second speaker is Dr. Emilie Veillat, a strategic account manager, veterinary public health at Boehringer Ingelheim. The company is a global leader in the animal health industry. She has a doctorate in veterinary medicine from the University of Liège and has over 15 years experience working in the animal health sector, including work with Zoetis, MSD Animal Health, Merial, and now Boehringer Ingelheim Animal Health. So the format for today, Lamyaa and Emilie will present the LastMile app for about 30 minutes, and then we'll go straight into a question and answer session in plenary. Anytime during the session, you may type your questions or comments in the chat. Before we begin, I'm going to do a quick poll of our audience to know what brings you here today. So I'm just launching that now, and just take a moment to select which one is closest to you. And if it's something else, just type it in the chat. All right, I'll end the poll, pop this up on the screen. You can all see it. So here we go. So the majority of people want to learn how mobile apps can help livestock projects. 6 out of 30 want to learn what data insights can be generated. 3 are just curious. And something else, I don't think I actually saw the something else in the chat. So the people who are after something else, please feel free to type that in. All right, I'll just shut that. Thanks for voting. It's very insightful. Okay, so with that, I will hand over to Lamyaa and Emilie. Go ahead and share your screen. Thanks.
Thanks, Vanessa. Great. All right, thanks everyone. So Emilie's going to be driving the presentation, so I might kindly request after a couple of slides for her to kind of click next for me. Great stuff. So yeah, we're here. Vanessa's given a little intro. We're here to talk to you about the LastMile digital application that has been developed for the BI project. So next slide, please, Emilie. Thank you. Great. So to start with, we wanted to outline the format of the presentation. So the talk will be in 2 parts. The first is essentially framing the LastMile project, which will help the audience here better understand the context behind the development of the app and who the users are. And then the second is a walkthrough with screen grabs of the application to show you the various features, and Emilie will take the audience through that. Right, next please, thank you. So the high-level objective of the LastMile project is to facilitate BI's expansion into the African market and thereby afford small-scale producers, SSPs, i.e. the farmers, with an improved portfolio of animal health inputs, which provides the SSPs with an enhanced ability to control disease and benefit from the associated productivity gains. And BI's two-pronged business model approach involves two initiatives, the registrations initiative and the distribution and awareness initiative. And the LastMile app, so the focus of our discussion today, is associated with the second, which is the distribution and awareness initiative, which aims to accelerate the rollout of the BI's veterinary products portfolio via an adapted business model. So next slide, please, Emily. Right, thank you. And at the core of the business model is the deployment of teams of animal health technicians called LastMile Livestock Service Providers, so LLSPs for short, from the local communities in each of the targeted project countries. But the point to pull out here is that the LLSPs are the users of the LastMile app. LLSPs are employed by distributors and agents in each project country, and they travel around their local regions, covering areas which are normally like very difficult or impossible actually to access through usual distribution networks. The LLSPs check the health status of the animals at the farm, they give basic husbandry advice, they raise awareness of products, etc. Next slide, please. So this slide here digs a little bit deeper into the profile of an LLSP to help the audience here really understand the users of the app a little bit more before Emily takes us through the next part. So in terms of education of the LLSPs, they should have either animal science or some sort of animal production training. In terms of language requirements, which is really important, the LLSPs are required to speak the relevant local languages, as well as, this is the key part, read and write in either French or English, depending on their country. The next point is to capture diversity. And the aim here was to, whilst recruiting these LLSPs, to ensure that most tribes and regions were represented, and not just in terms of language, but also for the LLSPs to be able to understand the tribal context. So that and for including all that, the LLSPs also kind of need to have, or the requirement was for them to have grown up taking care of animals, that kind of closeness linked to livestock. And then finally, to capture the gender component, we included female LLSPs in the teams. And again, just the last bit here, just on the background of the LLSPs, it's in terms of technology, they really needed to be familiar with using a smartphone. Great, thank you. So the LastMile project countries include Ethiopia and Kenya in East Africa, and Burkina Faso, Cameroon, Mali, and Nigeria in West Africa. And as mentioned in the last slide, at least for the app, language was an important consideration, as the LLSP needed to either be able to both read and write in English or in French. English for the English-speaking countries, you can see represented here by the British flag, and French for the French-speaking ones represented by the French flag. So I'm going to stop here. This was just a background framing session for the audience, and hand over to Emily from the BI team. We'll actually go into the development of the digital app and how it's actually being used in the BI project. Thanks, Emily. You're actually on mute.
Hello, good afternoon, everybody. I think you can see the bar on the top, no? Okay, I cannot remove it, I'm really sorry. Okay, so Okay, so thank you. So I will handle the second part of this presentation, which will be a kind of demo of the app that we have developed for the last mile activities. I hope it will give you a flavor of what we are doing for the last mile in Africa. So first, I think the first question is why we have decided to develop a new app dedicated to this project. So as mentioned by Lamyaa, this last mile project has several pillars, and one of them is the digital and digitalization of the last mile activities. So it was key for us to dedicate budget for the equipment of all the last mile with a tablet or a smartphone, and to provide the digital support that they need to support their daily activities. So after several discussions, brainstorming, field visit, workshop with the last mile, and discussions with their manager, it was clear that we need to develop something customized and really simple and easy to use for them. Most of them, they said everything is too complicated, it will take too much time, we don't have time between two visits, blah, blah, blah. So we really wanted to design this app for the last mile, but also with them. So we build all the functionalities with the last mile and their manager. And that was our objective, to be sure that they will use it every day, because it's not for me in my office in Lyon. So it's really for them and their activities. So that was the main objective of developing a new app and not using something existing on the market. So by creating something new, it was easy to customize it to the last mile daily activities and to their working conditions. For example, the luminosity, the size of the icons, the number of clicks, everything can be customized to their needs and their expectations. And what is also important is that this app is only for the last mile, so only for the sales rep dedicated to this project. It is not open to public and not available on app, on Android store or Apple store. So that's the frame of the development of this app. So it was around 1 year ago that we launched this app on the field. So we have one app, but in fact, this need to meet two different users' objectives. So on one side, we have the last mile user, and on the other side, we have Boehringer Ingelheim. So BI, who is managing the project with GAVMED and the Gates Foundation. So for the last mile, the objective of this app were very clear. They mentioned several times that we really need to help their organization. So kind of just a calendar, help to organize the meeting, organize their week. So something very basic, but it was their first demand. The second thing was the CRM tool, because they were using paper and pen. So they were recorded the number of animals, the name of the farmer on the paper. And then, of course, for the second visit, they have lost the paper, so they cannot remember the information. So it was really their second point. I want to follow up my customer and to have a record of the visit within the same tool. Then the last mile, they are kind of sales rep for the very remote area in Africa, but they are sales rep. So they represent the company and they represent the brand and the image of the company. So it was important for us to train them appropriately, to provide trainings on disease, on products, but also on herd management, on soft skills and so on. So this app was also a great tool to share material and information on products, diseases, and other topics. Then another point was also the guided navigation option, because they are working on very, very remote area with a small farm in the middle of nowhere. So sometimes it's difficult for them to find the next location or to remind where the farm is, so they can record the GPS data in the app. And the last point was the marketing tools, because they are doing visits of customers. So of course they need to show a brochure, poster, videos, and so on. So the app is also a way to to have this material and to share them with the customers during their visit. And on the other side, of course, we have BI. So for us, this app is also an important tool. So we can provide technical information and train the last mile, as I mentioned, but we can also, thanks to the information that we are gathering, we can build reports and ensure traceability of the last mile activities. So we can follow up the KPIs of the project and build reports, for example, number of visits per month, per week, on the different areas. So for us, it's a great source of information. And of course, the last point for us is African market is, as you know, is really difficult sometimes to understand or to have precise data. We don't have CSER or this kind of tool in Africa. So for us, it's a way also to collect data, to better understand livestock environment in Africa, and to, of course, to improve our market intelligence of this region. So that was the main objective at the beginning for the development of this app. So now I think I will show you the main functionality briefly of the app, and you will better understand what we are doing with this app, I think. So usually, I think as basic tool, we have on one side the digital app on smartphone, so mainly dedicated to the last mile. So all the last mile are equipped with a smartphone with this app, so it's easy for them to have access. And on the other side, we have one tool dedicated to that can be used on the laptop, and the main users are BI from the people working in BI for the project management, and of course the LastMile, the LSSP manager, so they can follow up the activity of their teams thanks to this admin module on laptop. So that's the two tools that are connected in this project. So first, this is the first page, a very basic page, a login page. So just here to mention that, of course, as mentioned by Lamyaa, we have two languages in this project, so English and French. So of course, this app is developed in both languages to support the LastMile activities. And as I said, one element from the LastMile was I need to have an app simple, easy to use, and adapted to my activities. So what is a week for a normal week for a LastMile? What they are doing? So they are doing administrative tasks. So they are organizing their week. They are programming their next meeting, they are sending reports to their manager, this kind of administrative normal things. Then their main part of their activities is the visits. So they visit farms, that's the bigger part, small farms in cattle, in ruminant, but also in avian. They visit retailers, so the small shop that are providing the vet medicines. And they are also visiting vets in the cities. So that's the three customers that they are visiting. The other things that they do on the field is they organize a lot of meetings. So here you can see a meeting. So it's not like in Europe, you are not in an office with a big PowerPoint, but it's in the middle of a village, just with a kind of big PowerPoint in paper. So it's their main activity, and the main demand from the field is that kind of meetings to better understand the diseases, the problematics, how to treat their cows and so on. So it's really appreciated by the customers. And the last part is trainings. So they have to train themselves. They have to better understand the diseases, the products, how they can use it, how they can promote it to the vets, to the vet shop, how they can improve their skills, their soft skills, and so on. So that's the four main part of a LastMile life, I would say, during the week. So based on these four pillars, we have developed something very simple. So here you can see an overview of the app. So you can see that we have only five icons that are representing the main activities of the LastMile. So first is calendar, as it's their top priority demand. Then farms for farm visits, of course. Then retailers for retailer visits and vet visits. Products for product information, and trainings for training section. So here it's a basic calendar, as you know, in your smartphone, but it was important for them to have everything in only one app. So also the calendar should be included in the app. So that's why we have put the calendar here. And it's, of course, it's linked to farms and retailer section. So when they plan a meeting, they can link directly the customer, they can click on it and access to the customer sheet. So that's the first thing. Then they have the farm section. So for them, it's important to record all their customers. So as soon as they will visit a new farm, or when they will visit back again a farm that they have already visited, they have this feature. So they will have a list of their customers. So that's the customer that they have already visited. So you can see with the icon if it's a ruminant and avian, or just avian farm. So they can see easily the name of the farm, the date of the last visit, and the main population in the farm. They can see it on a map. So maybe sometimes it's easier for them to visualize where is the farm and to organize their different visits in the region. And when they click on the farm, they will have a very a summary of the farm information. So of course, the name, the number of animal, the different options that they can use during the visit. So they can take note, they can access directly to the training, they can answer to a questionnaire, they can take pictures, as we can do in a normal CRM, but it's adapted to their activities. So everything is simplified with just the main things that they want to record, not 1,000 of options or questions that are not useful in this project. So here you can see that when they want to create a farm, it's really simple. It's just 3 steps. So of course, they will create the farm, they will complete the basic information. They can record the GPS coordinates. So that's really important when you work in the middle of nowhere. Sometimes you can record this kind of information for your next visit. They can also record if it's a pastoralist or not, because most of them, they work with a pastoralist or in the Maasai region. So they can indicate if the herd or the farmer is moving or not. Then they will record the contact details, so the number of people working in the farm, if the farmer is trained in animal health or not, if it's a male, a female, a name, the mobile phone, all this information that could be useful for the next visit or to contact the farmer again. And the last step is the livestock. So the aim is to record the number of animals for ruminant and for avian with the different sections, so they can put if it's calf, if it's sheep, if it's beef cattle, and so on. So they have also this information for the next visit. They can see if the herd has the number of animals has increased or decreased, why they can ask questions, they can follow up the customer. So that's the basic way to create a new farm in the system. So like in the CRM that maybe you know in other app. So during a visit, it was important to collect information and to ask questions and support their visit, because sometimes they don't know, they have something organized to ask questions with with questions useful, and then that will help to support their visit and provide advices to the customer or to prepare their next visit, and so on. So here you have some example of the questions that the LastMile can record within the app. So for example, the breed of the animals, if they are working with a vet or a paravet, what are the major challenges in the farm? What are the main diseases that the farm see? When was the last deworming of the animals? What is the vaccination program of the farm? Number of animal deaths within the last 6 months? Is it easy or not to access to the products in this location? So all these kind of questions, because as of today, it was difficult for us to access to this kind of information and to adapt our offer and our services to the field without this kind of information. So now everything is recorded in the app and pushed to the admin module thanks to the synchronization. So during the visit, as you have seen, we have several options that the LastMile can use easily. So one of them is the diagnostic approach. So it's a kind of diagnostic tree, because some of this small farm in very remote areas, sometimes it's difficult for them to have access to a vet quickly, or sometimes they are too far. So they ask a lot of questions to the LastMile regarding a cause which is sick, sometimes they mentioned some symptoms, and this tool was designed to help the LastMile to provide advices. Of course, some of the LastMile are vets, but some are just paravets. So the objective is not to give a final diagnostic, it's just to support their activity and to guide the farmer and to say, okay, following the symptoms that you mentioned, maybe it could be, I don't know, it could be FMD, or it could be tuberculosis, or I don't know, but it could be. So please call your vet. It could be an important disease. So it can help and support the farmer with this tool. So it's easy for them. They just click step by step with the different symptoms that they can see on the cars, with the questions that they can ask to the farmer, and they will arrive on a potential diagnostic. So that's another option that the LastMile can use. So again, it's also part of their training activity to increase their skills. And also during a visit, they can access easily to disease sheets. So they have a list of most common diseases in Africa, because the LastMile, they mentioned that sometimes they have they have questions regarding this or this disease, and sometimes they are not sure, or they don't have the answer, or they want to provide the correct information. So they can click on the disease and they can provide some, for example, the symptoms, the treatment that can be used, the risk, and so on. And of course, they have also a product section, because they are they are sales reps, so they are promoting the products in front of the retailers and the vets. So here they can access to the product sheet, so they have all the product characteristics and the key elements for the products, and for the route of administration, dosage, species, and so on. So that's all the main functionalities of the app during a visit. So here is just a funny story, because we put the possibility to take pictures during a visit, but for us it was just maybe a gadget or something not so useful during the visit, but during the field. So we have tested this app in Kenya. So we have spent 2 days in the Maasai region to test the app and to see if it can be used in the Maasai region, as it is a little bit specific and it's pastoralist and so on. So it was a key region to test the app. So, and for them, in fact, this functionality was the main important one. They were only interested in taking pictures, and just because sometimes they don't remember how many cars they have, so they just ask to the LastMile, okay, please take a pictures, and when you will come back, or when we will see us again, you can check the pictures and assess if the number of animals is still the same or not. So sometimes in Europe you think it's not so useful, but in Africa it's not the same story. So that's just a small story. So here is just an example of the guiding navigation. So they can go directly to their next visit just by clicking on their calendar, and then access to the customer, and they will have this kind of Google Maps geolocation, because it was also one of their demands. Sometimes they don't know how to go there easily and quickly, so it was just one additional option in the app. So that was for the farm section. So for the retailer and vets, it's really the same structure and the same design. So you create a retailer, you have the retailer sheet, you have several questions. Do you have a fridge? Can you store vaccines at low temperatures? Do you have trainings? Are you a vet, or are you a vet or not? What are the fastest moving products? All these kind of questions that can be asked during the visit. So I won't present all the retailers, but if you have questions, feel free to ask, but it's really the same structure as for the farmers. And then we have this, as I said, it's their main part of their activities is also to organize meetings. So here you can see a meeting in Kenya in the middle of a Maasai village. So it's just shared in the middle, just next to a tree, and it's 2 hours. It's a demand from the Maasai, so they just sent a message, and they just say, okay, we need a training on this or these diseases or these symptoms. So the LastMile can propose a date, and then they will bring all the people, and they will assist to the meeting and listen about the disease information, products information, and they can ask. So I went there and they ask dozens of questions. So it's a great moment for them, and they want to ask thousands of things. So it's a great and interesting moment. So for this activity, so the app was really simple, and it's just to record the date, the objective of the meeting, so the title, the description, the number of participants. They can take pictures of the meetings, and then they can push the report directly to their manager, because it's part of the KPIs that the manager is following. So it's just to simplify their activities. This future is just to avoid the paper and pen and simplify their day-to-day activities. So that's the end of the demo. So if I summarize where we are, so yesterday we moved from pen and paper. So here you can see a picture of what we received before. So it was after a meeting, you receive a list of names with details, with pictures. They take a picture and then they send it to you by email. But it's difficult for the manager to collect and to build reports based on this kind of pictures. So today, where we are really happy. So the app was deployed in Kenya, Ethiopia, Burkina Faso, Cameroon, Mali, Nigeria. So it was in May and June last year. All the last mile were trained on the app, their manager also, of course. And we have started to collect data and to follow up the activities of the last mile. But it's really the beginning. So today it's too early to have consolidated overview or statistic data or this kind of things that we can, we hope in the future we can do. So for tomorrow, of course, we have a lot of expectations on the ongoing action, but we hope that we will be able to develop maybe a version 2 of the app. So of course, the last mile, they are sending every day new ideas of features. They want a lot of things in the app. So we will have to prioritize and discuss with them. So how we can propose a very adapted version 2 of the app. So how can we improve the current version? Maybe open this app to the customer, because it's one of the demands from the farmers that they are also asking for features. So maybe we can open the app to the public, but today it's not decided. Of course, we want to improve our market intelligence and our understanding of the African market. So we want to run deeper data analysis thanks to the data collection that we are doing with the app. So we have started, but it's really the beginning. So we hope that we will be able to bring something more precise and more useful. And as mentioned by Lamyaa, we are working with GALVMed on this project. So we want to work and to share the data collected with GALVMed in order to help and support the M&E projects in the future. So that's where we are. So from paper and pen to an app. So it was our journey for this last mile project. So thank you very much for your attention. I hope it was clear. So if you have questions, do not hesitate.
Thank you so much. That was fantastic. So thanks to Lamyaa and Emilie for their presentation. There are quite a few questions popping up in the chat, which we will get to in just a moment. Before we do that, I thought we could just do a little poll, slightly differently from last time. I'll ask you all to reflect which part of the app or what part of the presentation really stood out to you, something that you thought, oh, that's kind of interesting, I'd like to know more, or that's something I'd love to be able to use. So take a moment and then type your reflection into the chat if you have a favorite bit or something that really stood out. So I'll give you all a moment to do that. Okay, so some responses are coming in, actually both related to diagnostics. So how is the app, can it be used for diagnostic work? How it can be used as a decision support tool? I think that's quite interesting to some people. People are interested in data collection for use in disease reporting. diagnostic confirmation of what gets into the app through lab test. Also the retailer feature. Some ideas, some thoughts about integrating the tool into the agricultural extension service. Quite a lot of thoughts. Also some questions. So that's, yeah, we can also get into some of these questions as well. Okay, great. So we'll wrap up this reflection and we'll come back to the questions that have been coming up over the last 20-30 minutes. Okay, just a moment. Okay, so thank you all so much for your thoughts. So what I will do is I'll return to some of the questions that were asked earlier, actually, during the presentation. So I'm sure Emilie and Lamyaa probably weren't monitoring the chat while they were presenting. So just to recap, there was quite a bit of interest and buzz as you were presenting from people who were very keen and curious to actually get their hands on the app and to use the app, with an understanding that right now it is only for use in this specific project. But there were some questions about plans to make the app or data available for researchers in the future, and what is the future of the app after the project? Does anyone want to reflect on that, Lamyaa or Emilie?
Emilie, I guess just quickly from my side, essentially it's as Emilie said, for now it is a closed application and is the kind of the rights are with BI. So from a BI's perspective, I'm not sure, is this something that you discuss internally, Emilie, at all that's come up, or it's just in terms of maybe to help the audience here. The timeline for this project, it started back in 2018, and it was an initiative that was established by BI themselves with support from GALVMed, and it's funded by BMGF. So in terms of when or how the project is running until the end of the year. So even from the GALVMed's perspective, the kind of the monitoring and evaluation component is being wrapped up. After that, I think it's kind of over to BI because there's the whole discussion of version 2, Emilie. I don't know what your thinking there is. Would BI hold on to it, or would it become open at an earlier date, or not at all?
For the version 2 of the app?
And version 1, yeah. If there's any discussions.
Sorry, can you hear me?
Yeah, I can hear you. Yeah.
Should we repeat?
Okay, yes, please. I don't know if you can hear me, but my connection, I have one word. So sorry, I hope you can hear me.
Yes.
Okay.
Lamyaa, do you want to recap what you said briefly?
Yeah, so essentially, Emilie, I was just telling the audience here that the initiative was established by BI and it's supported by GALVMed and funded by BMGF. So the owners of the app here, obviously it's BI and it's your kind of, it's more on the confidential side at the moment. You're using it internally and you've got thoughts to have another version of it coming out potentially. Were there any discussions within BI in terms of when, if at all, this will become open to anyone?
Okay, so yes, it was an internal development of the app, so with a target audience defined by BI at the beginning of the project. So it was a clear decision to not open this app to the public for this first version and to have something really internal dedicated to the last mile. And in terms of data, yes, today they are only for BI, but with the project to work with GAVMED, of course. But for the version 2, we received a lot of questions and suggestions to open the app to the public. Of course, we have some features in mind that can help the farmers and that can support the vets or the farmers. But it's under discussion. We need to assess budget. We need to assess the opportunities and if it's useful or not, because there are not thousands, but there are several apps already existing on the market. So the idea is not to create an extra app or something already existing, but something useful. So today, we are focusing on this version 1, focusing on last mile activities. So first, we want to improve the statistics and the data understanding and follow-up, and then we will discuss on version 2 and maybe sharing the data, I don't know.
Thanks very much. I'll pick up a few of the questions that came up. So one is, can the app communicate with other similar apps already in use?
No, it's really an in-house app, so it's working only with our BI, not BI environment, but just the admin module on the app, but no possible connection.
Okay, and another great question, which came from Dr. Shamsuddin in Nigeria, is the data collected at all shared with the relevant government veterinary departments to guide disease reporting, and is this potentially a future development?
No, unfortunately today it's not. It's just a kind of CRM. We are really at the start of this project, of this deployment of the app, but I think it's a really good idea to maybe use this data, but today it's really raw data, not really can be used by the government. But in the future, all this kind of great insight can be assessed. Yes.
Great. Okay, and now we have a slightly technical question, which is, how do the apps manage the local languages? That's from Elizabeth Arnaud from CGI, or Community of Practice on Ontologies.
So the LastMile themselves, they are speaking the local languages. So because they are working in very remote area, in small villages, with dialects and so on. But for the app, after discussions with the LastMile, it's mandatory that they speak either French or English to be a LastMile, to be able to work with their manager and with BI, of course. So we have decided to develop the app in English and in French only. So no local languages today is available in the app, but they can choose their language between French or English. It's the same.
Okay, great. Another question that came through, this is from Rob Kelly at the Vet School, University of Edinburgh. Great design to the app. It covers a lot of animal management data that can be used to inform future interventions. As ongoing data collection is useful to monitor improvements to individual farmers, how do you think you can maintain engagement with the app by farmers?
So today the farmers' feedback are really that for them it's not intensive production like we have in Europe. It's 2 or 3 cows with a kind of family management. It's really extensive breed with no really commercial objectives. So it's really small farms in remote area, the main audience for this project. So their expectations from the farmer is mainly to follow up their farm, to take pictures, to support them. So when they have a question, they want to have an answer. So the LastMile can record all the farm information on, for example, the number of deaths during the last 6 months. So when he will come back again in the farm, he can check the data and he can compare. So I've done several visits with the LastMile in the field, and it was interesting to see that the farmers, they have a lot of questions. So they want to know, and what about last time you said it was like this, the diseases, the vaccination program. So sometimes you have an evolution, you can check if he take into consideration the advices from the LastMile or not. So I'm not worried regarding the customer engagement. So it's also useful for them, in fact. So they need this information because they have also a pen and paper. So no traceability also in this kind of farms, of course. So it's useful for both species.
Great. There's been another question from Asma Saidouni. Any abilities of the system to interoperate with other apps or, for example, with other information systems for disease reporting?
No, today, no.
Okay. I think that's something that a few people have been interested in. A further question from Simon Holland is, how does the app manage the distribution of medicines and prescriptions linked to diagnoses? Do you track that kind of information in the app?
Also, the diagnostic tree, the kind of diagnosis that I've shown is just a support. And it's not, the objective is not to give a final diagnosis and to provide medicine. It's just to support this kind of small farm that sometimes they don't call their vet. So then they have to call their vet and to show their cars to a vet. So they don't bring product, or they don't, it's not question of prescriptions. So for the products, the only things that the app is doing today is for the retailer visit. So the app, during the retailer visit, the LastMile can record the stock of BI products within the retailer. So he can check the stock of BI products, he can record it, and he can share it with the distributor to organize a shipment if needed. And for the next visit, he can also check the stock level. So that's the only thing regarding products today in the app.
Good. Another question, this is from Amy Jennings, University of Edinburgh, and that is, does the app record the syndromes that are searched for on each farm?
Sorry, I didn't get the point.
Does the app record the syndromes that are searched for on each farm? So if a farmer is searching for different syndromes, does the app keep a record of those searches?
Yes, so all the things that during a visit, so when you are in the customer, the farm sheet, all the things that the LastMile is doing within this farm is recorded. So for example, if he checked disease information on FMD, for example, it will be recorded that the LastMile has checked FMD information. If he used the diagnostic tool, it will be recorded what was the final potential diagnosis. If he checked product information, it's also recorded. So all the things done during the farm visit is recording in the visit.
Great. We have about 10 minutes left, and I think this would be a nice chance to actually hear from people in addition to the chat. So if you'd like to actually speak your question, you can raise your hand. To raise your hand, click the reactions button. So on the bottom ribbon of the Zoom window, there's a little button with a happy face. It says reactions, and then you can raise hand, and then I would ask you to actually unmute and hopefully turn your video on so the presenters can see who's asking them a question. So see if anyone, I see a thumbs up. Otherwise, feel free to keep posting messages in the chat. That's perfectly fine. Maybe I can ask a question, and that is, what was the sort of biggest unexpected challenge, or perhaps one of the biggest surprises in a positive way in the process so far in rolling this out?
So I think surprise, it's COVID-19. So it was the deployment. So it's not very original, but it was true. So the deployment was planned in the middle of the COVID situation. So all the visits and training in the country were replaced by training by Zoom or Teams or this kind of tool. And I was really impressed, in fact, because I was really worried, because when you have to train people in Africa, in all the countries, in English, in French, their manager, the LastMile, so I was worried, but at the end of the day, everything was fine. So they were all trained. And when I see the figures, they are all using the app. So all the LastMile today, for sure, they use the app during all the visits. So it was great to see that this kind of tool can be used in this kind of situation. and the agility, the adaptation of the last mile was impressive in this situation. Yes.
Great. Maybe just related to that, do you feel like the app has actually provided some advantages during the pandemic at all?
No, I think not the app. If I'm honest, no. No.
Great. Okay, we have another question in the chat, and that's again from Simon Holland. As maybe for yourself, Lamyaa, does GALVMed act as a coordinating channel for new companies to access product, vaccines, dewormers, medicines from multiple suppliers? Is that a little bit what your group does?
So in terms of how we're supporting the BI last mile project itself, so we're providing the monitoring and evaluation component for this second arm. So if you notice this on the first slide, there were two components to the GALVMed, to the BI initiative. So there was the registrations initiative, and then there was the awareness and distribution arm. So the app obviously focused on the second one, which is the awareness and distribution, and GALVMed for part 2 provides the monitoring and evaluation of the BI last mile project. So we're looking at the performance of the LLSPs, performance of the different studies, adoption of products, beneficial impact, market understanding, etc. So that's what GALVMed does for this component that links back to the BI last mile initiative component 2. They do have an interaction as well on the registration arm, but it's not something that my team have an involvement in. And so I'd be a bit more careful about kind of commenting on that kind of side of things.
Thanks very much, Lamyaa. So we have time for 1 or 2 questions before we wrap up. There was also a comment, maybe some praise in the chat saying this is a fantastic breakthrough that will aid in record keeping and disease tracing. So I think that's a vote of confidence from one of our audience members. Okay. Okay, a few more questions flowing in. That's great. Okay, maybe these can be our final 2 questions. So the first one is from Shehu Shamsuddin, and it would be nice to mention who BI is working with in Nigeria so we could partner. So maybe we can take that offline. And a more general question again from Amy Jennings, University of Edinburgh. How does the app support the animal health assistants to give advice on non-BI products? Is that something you can respond to, Emilie?
So you have to keep in mind that they are kind of sales rep, so they are raising awareness regarding diseases and herd management, but they are employees of distributors locally. So of course they are giving advice on BI products only, but what they can do is that they can support in terms of diseases management or symptoms understanding and these kind of things, but of course they are not promoting products from Zoetis, or I don't know, it's not possible.
Okay, I hope that answers your question, Amy. And let's call this the final question. So Rob Kelly, once again, University of Edinburgh. Does the app, I'm just trying to understand this question. Does it assist GALVMed's monitoring the impact of drug treatments for individual farmers on their productivity? Did I get that right?
Yeah, I can kind of tackle that. So essentially, the project, if we think of the last mile project, it is a very geographically dispersed kind of project. They were originally in 9 different countries, and the number of LLSPs obviously covering these regions means that there were only certain kind of components of the study that from GALVMed's perspective, the M&E kind of available budget allowed us to kind of look at. And so there are many different kind of components to the how we actually go about kind of measuring this. But in terms of going down to individual farmers on their productivity, I don't think we're not particularly focused down to that level. We've got a modeling component to the project that can look at net economic benefits. But a lot of the work that we're maybe aiming to look at from triangulating whatever the app kind of gives us is kind of improving our market understanding or the collective understanding of the SSP sector and pulling in whatever data that we could eventually get from the app, and kind of triangulate or try to augment whatever it is that we can get. But again, this will be a little bit after the project closes for us to be able to put that all together. I hope that kind of answers it, maybe in a little bit roundabout way.
That's great. So we are going to just wrap up now. Time is up. Thanks to everyone for a good discussion and your interest. It's been a really enlightening presentation. I think we've seen the future somehow. So here's, I hope it's okay, Lamyaa and Emilie, if people have specific follow-ups, to get in touch with you. And we thank you for participating in the session. So this was one of a series of livestock data for decisions summer sessions. They continue into the next 2 weeks. We're very busy. So tomorrow we have a session at 4 p.m. British Summer Time, TaskMate Beta by Google, a tool for crowdsourcing data collection. Thursday we have counting cows in South Sudan using satellite imagery. And next week we've got Rangelands Atlas, building the evidence base for better decisions, and tags from text, an automated tool for standardizing livestock terminology. So quite a range of topics. They're all free. You can register for whatever you're interested in. All the sessions are being recorded, so if you miss one, they'll be available on the LD4D Summer Sessions website. We already have the last 2 that we did a few weeks ago. So do check that out, please. If you want to stay connected with LD4D and get news about future events or updates, visit livestockdata.org. There's data, there's visualizations, there's tools. You can sign up to the newsletter, follow on Twitter, or just get in touch by email. So thanks again to everyone, especially to our speakers, for their time, and we hope to see you again soon. All right. Bye, everyone.
Thanks. Bye.
Thanks for this opportunity. Bye-bye.